Thank you for your interest in our weekend PTA to DPT Bridge program at the University of Findlay. My name is Carrie Valansky and I'm one of the weekend faculty. I've taught in the program for the past 16 years and I'm excited to work with you as you carve a new path for yourself as a DPT. This short video will give you some insight into the design and format of our weekend program. Feel free to take notes, rewind and repeat, or contact us if you would like more information about our program. Housed within the College of Health Professions, we have two Doctor of Physical Therapy programs. One is our traditional DPT program, which is an entry-level degree held in a traditional weekday format. The second is our weekend PTA to DPT program, which consists of just short of 3 years of didactic coursework and clinical education. We graduated our first weekend class in 1997. As leaders in offering the weekend format, we transitioned from the bachelor's to master's, and in 2011, we graduated our first DPT class. The weekend program is a unique format. If you've done your homework, you already know that we are one of two programs in the United States that offer the PTA to DPT degree. It is referred to as a bridge program because we bridge the gap between your knowledge as a working PTA with the skill set that is required to be a DPT. We attract students from all states, practice environments, and years of experience. As you can imagine, this creates an enriching learning experience, and the students learn from the faculty as well as each other's experiences that they bring to the classroom. As working professionals, we integrate many of the classroom experiences into your clinical practice to help with application of the material and to give you time to practice your newly acquired DPT skills. First things first, here are some highlights of our program and the physical therapy profession. We are accredited by CAPTE, which is the Commission on Accreditation in Physical Therapy. Our 2014 and 15 graduation rate was 93%, and the pass rate on the NPTE exam was 89%. All of our students are assigned a physical therapy faculty member for advising from the moment you start on campus. You will keep that advisor throughout the entire time you are here. They will help you with registering for classes, moral support, if you have any difficulty in the program, or if you just need a friendly ear to bounce ideas off of. Our faculty bring in a variety of clinical and teaching experiences and have earned or are pursuing doctoral degrees, including the DPT, EDD, DSC, and the PhD. Many of us have been recognized as clinical specialists within the profession or have pursued other specialty certification and expertise as well. PTs are in high demand and remains an extremely attractive profession, and is projected to be one of the top jobs in demand over the next several years. Our classes are held Friday morning through Saturday evenings, and our academic year is split into 4 terms: winter, spring, summer, and fall. You will attend 6 weekend college weekends per term. Our current format is every other weekend for 6 weekends per term. Some weekends are longer than others. Our current summer sessions have an online and an in-person component, which helps ease the burden of travel and costs associated with coming to campus. During the first year of the program, you will complete Research 1 and Research 2. Then you will have the opportunity to work on research with a faculty member. Our faculty is very diverse and completes research in a variety of areas, including work injuries and rehab, orthopedic interventions, LSVT-BIG, professionalism in physical therapy, prosthetics, wellness and fitness programs, or you may want to work individually on a case report, which is a write-up of an interesting or unique patient that you've seen within the last several years. After completing your academic coursework, you will participate in 2 8-week and 1 10-week full-time clinical affiliations. Clinical affiliations may be completed in any state where we may obtain a contract. Those states include all states except for Massachusetts. Many students are able to complete their clinicals within an hour driving distance from their home. You will be responsible for your lodging, food, and travel. Clinical affiliations are overseen by the DCE at the University of Findlay and supervised by the licensed physical therapist in the clinical education site. Experiential learning is threaded throughout the curriculum, which includes hands-on patients evaluations. We may bring patients into the classroom for you to practice your evaluation skills. You'll do infant through school age developmental screenings, wheelchair evaluations, home safety evaluations, and so much more. Many assignments in the curriculum are directly tied to your work in clinical practice, which makes them real-world and meaningful to your personal growth. We offer electives throughout the program, and you will be required to take a selected topic, which are designed as advanced content in a specialty area of practice. At this time, these include manual therapy, medical genetics, advanced pediatrics, occupational health and sports biomechanics. The electives give you an opportunity to explore a little deeper into an area of interest or expertise. As faculty interests grow or change, electives may also change, giving you more options to choose from. An additional opportunity may be to travel to work in a pro bono atmosphere with an underserved population. So how do our students get into the program? Our program's admission requirements include evidence of graduation from a CAPTE accredited PTA program, evidence of completion of a bachelor's degree from an accredited institution recognized by the University of Findlay, a minimum of 1 year employment as a PTA by September 1st of the application year, 3 letters of recommendation, with one of the letters from a college faculty member, perhaps someone who taught you during your PTA education or prerequisites. 5 of the 7 prerequisites must be completed at the time of the application, and all prerequisites must be completed by January when starting the program. We also require a minimum overall and science GPA of 3.0 on a 4.0 scale. Our overall average admission GPAs over the past 3 years is 3.38, and the math and science GPA average is 3.49. For the length of the entire program, you must agree to reside in a state where we may provide online and clinical education. Those states include all states except for the state of Massachusetts. Students entering the PTA to DPT Bridge program must have a bachelor's degree. You may complete your bachelor's degree at any accredited institution recognized by the University of Findlay in any area of study, but you must also meet the program prerequisites. Many of our students complete their bachelor's degree in an area of science that also fulfills the prerequisites to our program. If you do not have a bachelor's degree yet, there are degree completion options, including weekend college and distance learning here at the University of Findlay. Our program prerequisites include a full year of anatomy and physiology. Your anatomy course must be taken in the last 5 years, as it is crucial for that knowledge to be fresh in your mind. We also require a year of chemistry, physics, and a statistics class. If you want to ensure that a course you take will meet our requirements, contact the Graduate Admissions Office. To begin the admission process, you will complete the general graduate application on the university's website. This application will be available from early January through May 1st. Once you select Weekend PTA to DPT Bridge program in the application, you will be prompted for all necessary application materials. Please note that your application and all required materials must be completely submitted by May 1st. Acceptance letters are mailed in late summer, and new students must attend orientation in the fall. The first class session begins in early January. Coursework continues for nearly 3 years, with 2 months of clinical affiliation shortly after the beginning of year 3 and 4 months of clinicals at the end of year 3. Successful physical therapy practice requires a broad array of basic knowledge, skills, and behaviors, including abilities in the area of judgment, integrity, character, professional attitude, and demeanor. Students are required to complete tasks such as observation and use of visual system, verbal and nonverbal communication, sensory and motor coordination and function, conceptualization, integration, and quantification, and behavioral skills, abilities, aptitudes, and general health. Students are encouraged to discuss any questions they have regarding these technical standards and essential functions with the university's Office of Disability Services prior to admission. One strength of our program includes the diversity of our student population. Our students have a wide variety of expertise, years of experience, practice settings, and come from across the country. In fact, students have attended this program from at least 42 of the 50 states. You will make lifelong friends and colleagues from all over the country. You can learn more about the profession and trends in physical therapy by visiting apta.org, especially the Prospective Students section, or ohiopt.org. For more information about our program, visit findlay.edu and search physical therapy, or contact our offices at 419-434-4863. To see what we're up to in our program, you can also follow us on Facebook. Thank you for your time to hear more about the University of Findlay's Weekend PTA to DPT Bridge program. Please do not hesitate to reach out to us with questions. Good luck on your journey as you move forward in making a decision to return to school to finish your DPT degree. We would like to welcome you to come to campus to meet with us in person and give you a tour. Thank you again for your interest, and please contact us if you have any other questions about our program.